Hello and welcome back to the CAPS 2 online library tutorial. In this next section, Section 3, we'll look at sources for finding clinical practice guidelines. Clinical practice guidelines are statements that are developed to help healthcare professionals and patients make decisions about screening, prevention, or treatment of a specific health condition. The first source that we're going to start with is the Cma Info Base, a specialized database by the Canadian Medical Association that gathers clinical practice guidelines. As noted on the home page, the Cma Info Base is a public database of clinical practice guidelines. It currently holds over 1,200 CPGs developed or endorsed by an authoritative health organization in Canada. There are a number of different ways to search in this database. You can go by specialties and get narrower and narrower through different medical specialties, essentially taking a topic search, for example, under specialties and then neurology. You can do the same by searching by developers, and this will enable you to search by the organization that produces or authors a particular set of guidelines. The most common way to search, though, is by keyword. And you can take a number of different keyword strategies in Cma Info Base. For example, if you put in asthma, children, the database search will automatically add these two together. So let's give that a try. Asthma children. And that brings us to 5 results. And these terms are being searched in the title, subject, and abstract. For each record, you'll get a short version of the bibliographic information. It includes the title and the developer. You'll see the View PDF link. Wherever full text is available for the Cma Info Base to link to, the database makes an effort to link us to that full text. Cma Info Base may not always be able to do this depending on the copyright. To view a more detailed version of the record, you can click on Detailed Results. And so in addition to providing more information about the authors, the number of pages, the subject, and the medical subject headings that are associated with that guideline, the database developers have also taken care to extract certain pieces of information for us. For example, whether a literature review was done, whether the guideline has been formally evaluated, and whether there are patient documents that accompany the guideline. So there's some value-added information here in the full display. Just returning to the home page, I'd like to make note that Cma Info Base makes an effort to collect very current guidelines. So if the guidelines have not been updated or produced in the last 5 years, they are sent off to the archive, the Cma Info Base archive, and will no longer be part of the general database. Cma Info Base also links to a number of similar guideline repositories or guideline databases. And if you look under other CPG databases, you'll see a listing both of Canadian sites and also international sites. In the international sites, the next source that I'd like to take you to is the National Guideline Clearinghouse, which is a U.S. source that's maintained by the U.S. Agency for Healthcare Research and Quality. It's very similar to CMA, but has more guideline records in it. In National Guideline Clearinghouse as well, guidelines must have been developed, reviewed, or revised in the last 5 years. The guidelines that you'll find here are produced by medical specialty associations, professional societies, public and private organizations, government agencies, or healthcare organizations. In the National Guideline Clearinghouse, you can also browse by disease or condition, or treatment and intervention. If you do browse, be aware that browsing is by MESH heading, so medical subject heading, and you have to be fairly familiar with the medical subject headings to find this useful. So for example, cancer information will be held under the medical subject heading neoplasms. More commonly, you can search by using a keyword approach in the search box. The National Guideline Clearinghouse offers quite a good range of keywording strategies, and to look to see what kinds of strategies you can use, click on Search Help for more details. For our first search in this database, let's try the topic of GERD or gastroesophageal reflux. I'm going to OR that with acid reflux as well, or dyspepsia. So I'm taking a number of synonyms and I'm using the quotation marks to search as a phrase search. You can also adjust the number of results per page, and ours is currently set to 20, but you can go as high as all the guidelines or as low as 10 guidelines per page. And so you can see that this was our full search string here, and that there are 104 resulting guidelines. Again, similarly to Cma Info Base, the guideline records will be shown in the short version only in this level of display. So if you're interested in seeing more details about our guidelines, you need to click the title, and this will take you to the brief summary. The brief summary is very useful because it includes the recommendations that come out of the guidelines and the evidence supporting the recommendations. So there's been quite a lot of work on the part of the database developer to provide further information without you having to go to the full text for it. This is the brief display, as I have said. And if you'd like to find full text, again, with National Guideline Clearinghouse, they will make an effort to link you to the full text wherever possible. But again, because they are not the copyright holders, this may not always be possible. In National Guideline Clearinghouse, there's also the complete summary display. And in this complete summary display, there's even further information. So in addition to providing information about the major recommendations and the evidence supporting the recommendations, you can find other information such as the scope, the methodology, the implementation of the guideline, etc. So as you can see, there's been a lot of work on the part of the guideline or the guideline.gov to give you more information than just the title and the abstracts. Another handy feature about National Guideline Clearinghouse is if you go to the home page, and then if you look under Guideline Synthesis, under the Compare table, what you'll see is a list of topics for which guideline syntheses are possible. So for example, if we scroll through, we'll see that GERD is one of the subjects for which a synthesis of a number of recent guidelines is presented. So this is, again, written by the National Guideline Clearinghouse. And what it does is it brings together several different current set of guidelines and provides a summary or an overview of the contents of these three different guidelines. Guideline syntheses are possible or available rather for a limited number of topics so far, but the National Guideline Clearinghouse is making an effort to include more of these kinds of syntheses. If we return to the home page, you'll also see under Compare something called View My Collection. And this is kind of an interesting feature that you can take advantage of. So let's say, for example, we return to our topic of GERD and we run the search again. And if we would like to compare a number of guidelines, we can select them by clicking in the search box, add to my collection, and then run a comparison on the fly. So if you click on Compare Checked Guidelines, what this does is it generates a comparison table on the fly, and it takes the classification or the fields from the summaries, and it compares based on those categories. So title, the dates, who the guideline developers are, the composition of the group that authored the guidelines, financial disclosures, intended users, the guideline objectives, etc., etc. So this is a way of viewing, if you were trying to select a set of guidelines, this is a way of viewing a comparison so that you can make a decision about which of the guidelines that you would want to find full text for. It's another way of gleaning some more information before you spend time finding and reading the full text. The last source that I'd like to show you in this guideline section is a database called TRIP database. TRIP database stands for Turning Research into Practice. And TRIP defines itself as a clinical search engine designed to allow clinicians to quickly find answers to their clinical questions using the best available evidence. I like to think of it as a huge sort of meta search engine of synthesized sources. So for example, in TRIP, it's usually a keywording process as well, and it allows both phrase searching and Boolean searching. So I'm going to try a search for our earlier topic, which was smoking cessation and alcohol use, or alcohol dependence as a phrase, or alcoholism. And I'm going to use the parentheses to capture the terms that are synonymous with alcoholism and combine that whole string with smoking cessation. So if we run this search, what you'll notice, this next part is interesting, is that there's a filter. There's a built-in filter. And this filter from green to yellow walks you through the hierarchy of evidence. So green items are considered higher on the hierarchy of evidence than yellow items, which fall sort of at the bottom. So we move from publications like evidence-based synopses into patient information and news. You can actually adjust this filter, for example, so that you only end up with results that are classified as green or quite high on this hierarchy of evidence. The reason that I mentioned the TRIP database in relation to clinical practice guidelines is that TRIP can be used as a source to search guidelines. And one of the nice things about it is that it searches a huge number of guideline repositories at the same time. So as you can see here, it's selecting guidelines from Australia and New Zealand, Canada, UK, US, and if there are guidelines from other parts of the world, it will list them under Other. TRIP can also be used as a source for finding out systematic reviews as well, because systematic reviews is another category that is provided in the filter. Again, with TRIP, if there is full text available to link to, and if TRIP database can do so without breaking copyright, it will provide the links by displaying a PDF icon. In other instances, you may need to try linking and following the links to see where you can find the full text. So let's look under, for example, the Canadian guidelines for this topic. You'll see that it's actually pulling out from a wide variety of sources. For example, British Columbia Perinatal Health Program. You'll see this one comes out of the Cma Info Base, etc., etc. To view a list of all the sources that are searched by the TRIP database, you can go to the home page, and at the very bottom in the gray zone, at the bottom of that page, you'll find a section, a link rather, called Sources Searched by TRIP. And this will give you a sense of the sheer volume of sources that are covered here. So for example, for systematic reviews, these are the sources that are being crawled by TRIP to collect information. For Canadian guidelines, TRIP searches not only the Cma Info Base, but other sources such as the Clinical Practice Guidelines and Protocols in British Columbia, Canadian Chiropractic Association, etc. So TRIP is an excellent resource for beginning your research in that it gives you a good lay of the land. I hope that you will find these sources useful, and if you have any questions about anything that was covered in these online tutorials, please feel free to contact me. My contact information can be found by going to the library's homepage, and under Subject Resources, you can go to Subject Guides, and if you look under PHAR for Pharmacy, you'll find the Pharmaceutical Sciences Subject Guide. My contact information, you can click to from here at the top, or you may catch me online in this Meebo chat window. This page is handy because it also provides information about questions that you may frequently have, such as what databases are good for pharmacy, how do I cite in Vancouver style, what electronic book collections are helpful for pharmacy, and handouts that are associated with library workshops. Thank you for going through these modules, and I look forward to hearing from you soon.
recording